Hello, Mr. Jones. I just kind of want to talk to you a little bit about hypertension and just some ways that can help you kind of understand what's going on with your body more. So, with primary hypertension, that's when there's no known cause. So, like a disease or anything is not going to cause it. It's more genetics or kind of your history that contributes to primary hypertension. Um, Secondary hypertension is due to a separate diagnosis that could be kidney disease, or like renal disease. It could be due to a hormone in our body that regulates blood pressure, like it's called aldosterone. You There's also thyroid issues that can contribute to hypertension. So otherwise, it's other ailments that contribute to hypertension. And the only way to actually fix secondary hypertension is to fix the primary problem first. So secondary hypertension will not respond to medications, well, antihypertensives, but primary hypertension will. Now, complicated hypertension is when hypertension actually starts causing more issues in the body, um, like heart failure or the ability of the heart to not uh, pump effectively, um, or stroke, things like that. So, based on that information right there, due to your history, and your genetics, you have a strong genetic background with hypertension and with type 2 diabetes, it also puts you at a way, way higher risk of getting hypertension or your hypertension actually getting worse. Um, Now, I do want to go over a few things. Now, with complicated hypertension, it can what can happen is your heart is working so hard. It is working very, very hard to the point where um, it actually starts to harden or thicken, because it's working so hard to pump that blood efficiently. And the harder it gets, the uh, weaker it becomes, and the less effectively it is able to pump blood through your body. Um, with that being said, this is most likely contributing to your shortness of breath and um, getting fatigued. Now, high sodium intake and drinking beers and inactivity and stress are all putting more stress on your heart along with your hypertension. Now, decreasing your sodium intake can help. Um, Possibly taking antihypertensives and monitoring your blood pressure. More physical activity, not just um, on your job, maybe taking some walks every now and then. And then reducing your stress. Yes, it can be a very stressful job, but finding a um, activity that kind of helps reduce that stress, even taking walks may help reduce stress. Quitting smoking was very good. That actually helps a lot. Um, so I appreciate you